Almost everyone has looked down at their arm, their chest, or their leg at some point and noticed a small red dot that wasn't there before and felt that immediate quiet moment of uncertainty about what it might be. The instinct to worry is understandable. Skin changes feel personal and visible in a way that internal symptoms often don't, and the internet is not always helpful when someone types red dot on skin into a search bar and gets back a list of possibilities ranging from completely harmless to genuinely concerning. The reality is that the vast majority of tiny red dots that appear on skin have completely benign explanations, and understanding the most common causes makes it much easier to know when something is simply a normal biological occurrence and when it might be worth getting a professional opinion. The first and most important thing to understand is that tiny red dot on skin is not a single condition with a single explanation. It's a description that can apply to several completely different things, each with its own biological origin, its own appearance characteristics, and its own implications for whether medical attention is needed. Treating all red dots as interchangeable leads to a lot of unnecessary anxiety about harmless spots and occasionally to dismissing something that actually deserves a closer look. The goal today is to walk through the most common types, explain what's actually happening biologically in each case, and give a clear picture of what distinguishes one from another. The most common type of tiny red dot that dermatologists encounter, particularly in adults over 30, is something called a cherry angioma. If you've noticed small bright red dots on your torso, arms, or shoulders that have appeared gradually over the years and don't cause any discomfort, there's a good chance at least some of them fall into this category. Cherry angiomas are benign overgrowths of small blood vessels, called capillaries, just beneath the surface of the skin. The medical term for this type of growth is a vascular lesion, meaning it originates from blood vessels rather than from the skin cells themselves, which is why the color is such a vivid bright red. You're essentially seeing a cluster of tiny blood vessels through a thin layer of skin above them. What makes cherry angiomas so recognizable is their appearance. They tend to be very small, usually between 1 and 5 millimeters in diameter, with a color that ranges from bright cherry red to a slightly darker purplish red depending on the density of the blood vessels involved. They're typically smooth, slightly raised above the surface of the skin and have well-defined, even borders rather than irregular edges. When pressed with a finger or a glass, they tend to blanch, meaning they temporarily lose their color under pressure because the blood can be pressed out of the vessels momentarily, which is a characteristic that helps distinguish them from other types of red marks. Why do cherry angiomas appear, and why do they become more common as people get older? The honest answer is that the exact mechanism isn't completely understood, but they're strongly associated with aging. They're relatively rare in people under 20 and become increasingly common after 30, with the majority of people having at least a few by the time they reach their 50s or 60s. Genetic factors appear to play a role, since they tend to run in families. Hormonal changes, particularly during pregnancy, can also influence their appearance. Whatever the exact trigger, the underlying process involves a localized overgrowth of capillaries in the upper layer of the dermis, creating a small cluster of extra blood vessels that becomes visible through the skin above. The good news about cherry angiomas is that they are essentially always benign. They don't become cancerous, they don't spread in the way that concerning lesions do, and they don't typically cause any physical symptoms unless they're in a location where they get irritated by clothing or jewelry and occasionally bleed with friction. The main reason someone might choose to have them removed is cosmetic, and dermatologists have several effective options for doing so, though removal is entirely optional from a medical standpoint. What does warrant a dermatologist visit is if a spot that looks like a cherry angioma starts changing, growing rapidly, developing irregular borders, changing color unevenly, or bleeding without any obvious irritation. These changes would make it worth having a professional take a look to confirm what the spot actually is. A completely different type of tiny red dot, and one that carries a very different set of implications, is called petechiae. Petechiae are small, pinpoint red or purple dots that appear when tiny blood vessels called capillaries break and leak a small amount of blood into the skin, unlike cherry angiomas, which are caused by an overgrowth of blood vessels. Petechiae are caused by bleeding, very minor bleeding that stays trapped just beneath the skin's surface rather than forming a visible bruise. They're typically flat rather than raised, meaning they sit at the level of the skin rather than above it, and they don't blanch when pressed because the blood is outside the vessels rather than inside them. This non-blanching characteristic is one of the key ways medical professionals distinguish petechiae from other types of red marks. The causes of petechiae range widely, from completely innocuous to medically significant, which is why this particular type of red dot deserves more attention than the others. On the benign end, petechiae can appear from physical strain. Intense coughing, vomiting, or heavy lifting can create enough pressure to rupture tiny capillaries. Particularly around the face and eyes, tight clothing or a blood pressure cuff can sometimes cause them locally in the area of compression. Sunburn can occasionally produce petechiae-like marks in the affected area. In these contexts, they're essentially harmless and resolve on their own without treatment. However, petechiae can also be associated with conditions that do require medical attention. Certain infections, low platelet counts, blood clotting issues, or reactions to medications can all cause petechiae to appear, sometimes spread across larger areas of the body rather than appearing in isolated spots. The distinction between benign and concerning petechiae often has to do with context, where they appear, how many there are, whether they appeared suddenly across a wide area, and whether they're accompanied by other symptoms like fever, fatigue, unusual bruising, or feeling generally unwell. Petechiae that appear suddenly across a large area of the body that spread rapidly or that come with any of these accompanying symptoms are the kind that warrant prompt medical evaluation rather than a wait-and-see approach. This is one of the clearer situations in dermatology where the general rule of most red dots are harmless has an important exception and where taking the time to get a professional opinion is genuinely the right call. Another very common cause of red dots and red bumps on skin, particularly on the upper arms, thighs, and cheeks, is a condition called keratosis pilaris. This one is technically more of a texture issue than a pure color issue, but it frequently presents with enough redness and small dot-like appearance that it fits naturally into this conversation. Keratosis pilaris is an extremely common condition. Estimates suggest it affects roughly 40% of adults and an even higher percentage of adolescents, in which keratin, the protein that makes up the outer layer of skin, builds up inside hair follicles and creates small plugs that produce a rough, bumpy texture. Each individual plug creates a small raised bump, often with a reddish or sometimes slightly brownish tone around it, giving the affected skin a characteristic rough, dotted appearance that's sometimes described as resembling the skin of a plucked chicken. Despite how common keratosis pilaris is, it frequently gets misidentified as acne, dry skin, or an allergic reaction by people who don't know what they're looking at. The condition is entirely benign. It doesn't cause any health problems, it isn't contagious, and it doesn't indicate any underlying disease. It does tend to be persistent and somewhat stubborn to manage, largely because the underlying tendency to produce excess keratin in the hair follicles is genetic and doesn't simply go away with standard skincare products. The redness and rough texture can fluctuate with the seasons, typically worsening in winter when skin is drier and improving somewhat in summer, and tends to become less prominent for many people as they move through adulthood, though it doesn't disappear entirely for everyone. Folliculitis is another condition worth including in this conversation, since it produces red dots or bumps that are often confused with acne or other types of skin concerns. Folliculitis refers to inflammation of the hair follicle, usually caused by bacteria, though fungi and other organisms can sometimes be involved. It typically appears as small red bumps or pustules clustered around hair follicles, most commonly on the thighs, buttocks, back, or areas where skin experiences friction from clothing. It can also appear on the face, particularly in areas where hair grows. Mild cases of folliculitis are extremely common and often resolve on their own without treatment, particularly if the contributing factor such as tight clothing, a contaminated hot tub, or shaving irritation is addressed. More persistent or widespread folliculitis may benefit from dermatological evaluation and treatment. Understanding the differences between these common types of red dots already provides a much clearer framework for interpreting what might be appearing on your own skin. Cherry angiomas are bright red, raised, smooth, blanch under pressure, and are most common on the torso in adults over 30, generally completely benign. Petechiae are flat, pinpoint, don't blanch under pressure, and their significance depends heavily on context and accompanying symptoms. Keratosis pilaris produces rough, dotted redness primarily on the upper arms, thighs, and cheeks, is extremely common and harmless, and tends to be persistent but manageable. Folliculitis appears as red bumps clustered around hair follicles and is often linked to an identifiable trigger. Beyond these four, there are other less common causes of tiny red dots worth being aware of at a general level. Angiomas of other types, beyond cherry angiomas, can sometimes appear on the skin. Contact dermatitis, a reaction to something the skin has come into contact with, can produce small red dots alongside other symptoms like itching or swelling, and in rare cases, certain systemic conditions can manifest with skin findings including red dots, which is part of why a broader clinical evaluation is sometimes needed rather than treating skin findings in complete isolation from everything else going on in the body. The general approach most dermatologists recommend when someone notices a new red dot or a collection of them is to pay attention to a few specific characteristics rather than immediately assuming the worst or immediately dismissing it. How quickly did it appear? A dot that was there gradually over months behaves very differently than one that appeared overnight or across a day. Is it changing, growing, spreading, or shifting in color? Stable spots that have looked the same for years are generally much less concerning than spots that are actively evolving. Does it blanch under gentle pressure? Is it raised or flat? Are there any other symptoms accompanying it, either in the skin or elsewhere in the body? Most of the time, running through these questions leads to a reassuring conclusion. A cherry angioma that's been there for 2 years and hasn't changed is almost certainly exactly what it appears to be. But the same questions applied to a cluster of flat, non-blanching dots that appeared suddenly alongside feeling unwell point clearly toward getting a professional evaluation rather than waiting to see what happens. This is ultimately the most useful takeaway from understanding these different types of red dots. Not that every spot needs to be examined by a dermatologist, but that knowing what to look for makes it much easier to distinguish between the situations where that professional evaluation is genuinely helpful and the situations where reassurance is simply a matter of understanding what's normal. The vast majority of tiny red dots on skin are completely benign and require nothing beyond the occasional cosmetic consideration. But having a clear framework for recognizing the exceptions, particularly petechiae that appear suddenly and spread, or any spot that changes significantly in appearance over time, means that if something does warrant attention, the decision to seek it comes from understanding rather than from either unnecessary panic or uninformed dismissal.